If you've clicked on this video, it's likely that you're struggling with your shoulder impingement, or maybe somebody has diagnosed you with it. Now, what I hope to achieve in this video is to help you understand the if, the why, and the how. Basically how you can help yourself with the problem and what you should do in order to prevent it in the future. What we'll discuss is a little bit of anatomy, not too much, 2 tests to help you identify if the problem is actually shoulder impingement, 3 exercises which have an over 90% success rate in helping with the problem, and 3 tips which will help you to prevent it in the future and manage it along the way. So let's get started. This is the anatomy of the shoulder complex. What we have here is the shoulder blade, the scapula, the humerus, and this space between these 2 bones right there is what's very relevant. The tendon that comes from a muscle through there and attaches into here, it helps to raise the arm up. And this is also where the entrapment happens. So if I perform tasks on a daily basis that put my hand into this position, which is a very sensitive position because it rotates the whole shoulder complex, twisting this tendon, it increases the chance that I'm going to build up irritation and inflammation. And that's when the pain comes, maybe a little bit of tissue damage, and then we have a shoulder impingement. So we want to make sure that we have good function of the shoulder blade and we have good habits that keep our arm in the right position. So not like this with the thumb down, but maybe with the thumb up. And maintaining these good habits is what helps us to heal and prevent this problem from coming up in the future. Now let's discuss the tests. First of all, if you cannot lift your arm up in order to do the tests because of inhibition or because of the pain, then I would advise you go and get an ultrasound or an MRI, and this can be done by seeing an orthopedic doctor. You want to make sure that there's not a complete tear of the muscle. However, if you can do these tests and you can lift your arm up, then here's the first test to see if you have shoulder impingement. Now, you bring your arm up with the thumb up, bring it out 30 degrees, rotate it in. This may already exacerbate some of the symptoms. You apply a little bit of downward pressure, and if this gives you the pain in the shoulder you've been having all along, you're probably dealing with a shoulder impingement. The second test looks like this. You bring your arm up with the thumb up, you bring it in like this and across. Use your other hand to apply a little bit of internal rotation like that, and if this exacerbates your symptoms in your shoulder, you're likely dealing with a shoulder impingement. So now we'll move on to the exercises, which are highly effective, so give them a try. The first exercise I'm going to show you is hanging. Now, I don't have anywhere to hang from in my office, so I'm going to ask you to use your imagination, and I'm going to hang from this stick that would be placed somewhere. This can be a branch, this can be a staircase, rings, however, be careful with all of them. And what you're going to do is you're going to hang for 10 to 30 seconds, take a break of 1 minute, and then repeat that 3 to 5 times. Your first hang should be with your feet still on the ground so that you can see how much you can actually tolerate. So what I would do is place my hands like this and then hang down passively with my feet on the ground. And once you know what you can tolerate and you see improvement, you can then lift your feet up and passively hang. If you don't have anywhere to hang from at home or in your office, or you don't have a gym membership, then I will show you a different variation where you can use a stick like this to create a bit of traction through the shoulder, and this will be the second exercise. So this is the second variation of hanging. This is something you can do at home if you don't have somewhere to hang from. You can use a stick of some sort, like I have right here, and what you're going to do is the arm that is impinged, that's the one that you want a traction. You take the stick like this, you hold up here, and then you lean into it, and you want to create this traction feeling through the shoulder, and you're going to hold that for 10 to 30 seconds. Once you're done, you take a 1 minute break and you repeat it 3 to 5 times. Don't do more than you can. It's not necessary that you actually go 90 degrees or more. If you can only tolerate this, then that's okay. Work your way through this slowly, please. And that's the second variation of hanging. Give it a try. The second exercise we'll discuss is one of my favorites because it really encompasses many things. Now, it's pretty simple, and once again, don't overdo it. Don't lift your arm higher than you feel comfortable. Now, what this exercise tries to do is develop a better habit of how you use your arm. Now, most of the time, we end up reaching like this with our thumb. And as you can see, this really elevates the shoulder, entrapping that muscle even more. What we want to do is, instead of reaching like this with our thumb up, we want to reach with our pinky finger. So you initiate the movement like that versus like this. And what you're going to do is you're just going to practice reaching up, but pay attention to the position of your wrist. So you don't want this, you want this. And reach up with your little finger, pinky, just like that, up, as far as you can, and down. What this does is it helps to bring the shoulder in the right position. So you're not doing that, but instead you're doing this. So you can do this anywhere from 5 to 10 times. Take a break for about a minute and repeat 3 to 5 more sets. Once again, tilt the wrist this way and reach up with the pinky, and try to incorporate this into your daily life when you are reaching for something up above your head. So you're not doing that, instead this. Give that a try. The third exercise I'm going to show you involves rotating the arm out. When we're in pain in the shoulder, we tend to keep it in this position and protect it. Now, what we're going to need is maybe a rolled up towel and an elastic band. You're going to take the rolled up towel, you're going to put it under your armpit here to secure your shoulder, to ensure that the movement is coming from here, you're not just waving your arm around all over the place. Now, you can take the elastic band, you can tie it to something, but you can equally just hold it. And what you're going to do is, with the palm up, you're going to rotate the elastic band out like this with the shoulder, and go as far as you feel comfortable. It's not about going all the way. It's just about creating a little bit more strength and stimulating the right muscles. You're going to do this 5 to 15 times. You're going to take a break for about a minute and repeat 3 to 5 sets. If this is easy, you can move on to a second variation of this, where you can use both arms. Now, try to make sure that you have a good posture in this, and you're just rotating out like that. The tension of the band should be appropriate for you to do this correctly. If that's easy, you can bring out your arm straight in a third variation like this and open up fully. Locked elbows, palms up. Once again, 5 to 15 repetitions, 3 to 5 times with a good break in between. Give these a try. They're going to help make some strength in the shoulder and help you progress with improvement. Let's discuss top 3 lifestyle tips which can help you recover or prevent the injury from coming back. The first thing you should do is consider doing a few minutes of exercise every day for your shoulder, whether it's the exercises that I showed you previously or something new, just to make sure you maintain full range and strength throughout your shoulder complex. Second thing you can do is use a mouse like this, because this can help you to keep your shoulder in a more neutral position as opposed to like that. So a vertical mouse. Holding your hand in this position can aggravate the impingement, Having your thumb up can help you to recover from it and prevent the problem from coming back. The third tip is when you are lifting something, whether it's in the gym or your groceries, make sure that you don't lift this way with your thumb down, that you lift your groceries or any heavy object with your thumb up. And lastly, be patient and look after yourself. Good luck with all of this, and let us know if you need any further help. Have a look at our website. There's plenty of information there. Take care.